Hi there, pharmacist here. So hopefully you found this because you are either a patient wondering about the side effects of Lexapro, also known as ESCITALOPRAM, or you're a healthcare student or healthcare professional that was concerned about the side effects that their patients may experience and were wondering how to treat them. So why are Lexapro side effects worth discussing? Well, the National Health and Nutrition Examination Survey found that between 2015 and 2018, approximately 1 in 7.5 adults 18 years of age and older used an antidepressant such as Lexapro in the past 30 days. Also, the use of antidepressants increases with age, and almost 1 in 4 women 60 years of age or older have used an antidepressant in the past 30 days. Since the usage of a drug like Lexapro is so far-reaching, it's probably a good idea to know more about more common side effects and how to treat them. So what are the side effects of Lexapro? The more common side effects are diarrhea, dry mouth, heartburn, sleepiness or unusual drowsiness, and trouble sleeping. Some of the less common side effects are feeling bloated or full, burning, crawling, itching, numbness, prickling pins and needles or tingling feelings, decreased appetite, excess air or gas in the stomach or bowels, general feeling of discomfort or illness, increased swelling, joint pain, muscle aches and pains, pain in the neck or shoulders, pain or tenderness around the eyes and cheekbones, passing gas, runny nose, shivering, sneezing, stuffy nose, tooth problems, unusual dreams, unusual drowsiness, dullness, tiredness, weakness or sluggishness, and yawning. So let's go over the recommendations and treatments for the 5 most common side effects of Lexapro. So what can be done to help patients with diarrhea? Typically, when a patient has diarrhea, the thought process is that it is usually self-limiting and it should resolve itself in 2 to 3 days. The main recommendation is to rehydrate with an electrolyte water, such as Pedialyte, in order to replenish the body of lost fluids and electrolytes. Depending on the severity of the drug-induced diarrhea, the over-the-counter product loperamide or Imodium AD can be recommended, and it is usually dosed at 4 milligrams for the initial dose, then 2 milligrams after each loose stool with a max of 16 milligrams per day. What can be done to treat dry mouth? Dry mouth, or xerostomia, can contribute to dental health issues such as dental caries and infections such as thrush. This drug-induced side effect is often temporary and reversible. It can be treated by lowering the dose of the drug to the lowest effective dose. If changing the dose does not help or it is not possible, then the patients should seek help from their dentist to have a fluoride-containing sealant applied to areas of concern, or to get a mouthwash prescribed containing 1% chlorhexidine and 1% thymol to prevent dental caries. It can also be recommended the patient start chewing a xylitol-containing gum to enhance salivary flow. What about treating heartburn? Establish when and how the medication is being taken. Sometimes taking the medication after a meal or snack will reduce heartburn, and sometimes some people may require an empty stomach. Another recommendation is to stay upright for at least 30 minutes after taking Lexapro. As for dietary recommendations, ginger, licorice, sipping apple cider vinegar, or drinking tea may be beneficial. Also, make sure to avoid triggers such as cigarette smoke, fatty foods, or spicy foods. Some other recommendations are to make sure to eat the last meal of the day at least 3 hours before bedtime and maintain a healthy weight. Over-the-counter products such as antacids and other heartburn medications may be used, but they can interfere with other medications, so it is wise to only use them after consulting a healthcare professional. Over-the-counter products are only temporary fixes. How about treating sleepiness or unusual drowsiness? First, avoid activities that require being alert, such as driving or actions that require high levels of coordination until the level of drowsiness is established. It's also important to make sure to practice good sleep hygiene, which includes getting a good night's rest. More on sleep hygiene later. It's also important to limit substances that may contribute to sleepiness or drowsiness, such as alcohol or antihistamines such as diphenhydramine. If the issues persist, consider taking the medication right before bedtime. Now, what about trouble sleeping? There are several recommendations that can be made, with the non-medication therapies being preferred. Practicing good sleep hygiene is very important when having trouble sleeping. Sleep hygiene consists of making sure the sleep environment promotes uninterrupted and consistent sleep. It's all about setting yourself up to sleep well every night. Some examples of things to consider when practicing good sleep hygiene are, but not limited to, the following. Keep the bedroom comfortable and inviting for relaxation and dozing off. The bedroom should be free of disruptions, quiet, and dark. Prioritize sleep. Keep a regular sleep schedule, and don't overdo it with naps throughout the day, and have a fixed wake-up time. Create a 30-minute relaxing pre-bed routine so that sleep feels automatic. Unplug from electronics to avoid excessive mental stimulation 30 to 60 minutes before bedtime. Don't toss and turn. If you haven't fallen asleep after 20 minutes, get up and stretch, read, or do things that are calming in low light before trying to go to sleep again. Reserve the bedroom for only sleep and bedroom-related activities, and incorporate positive habits to support the circadian rhythm, such as daylight exposure. Dietary considerations are also important when treating trouble sleeping, such as avoiding substances such as caffeine, nicotine, or eating heavy meals before bedtime, and the use of weight loss stimulants. Another consideration when having trouble sleeping is to try incorporating some breathing exercises in the nighttime routine. For example, first exhale completely through the mouth, then inhale through the nose to a count of 4. Hold the breath for a count of 7. Exhale through the mouth for a count of 8. And then repeat this cycle for 3 times. Another non-medication recommendation is moderate exercise for 20 to 30 minutes 3 to 4 times weekly, also making sure that it is not too close to bedtime. There are prescription medications that can aid in sleep, such as benzodiazepines, but they can become addictive, and they are also dangerous if taken with alcohol, and likely should be considered only after other therapies have been exhausted, and only if the insomnia is severe or chronic. As for over-the-counter products, there are medications that contain an antihistamine, such as diphenhydramine, that can cause drowsiness when dosed between 25 to 50 milligrams 30 minutes before bedtime. Melatonin is another over-the-counter product that helps patients get back on track. Melatonin is dosed between 0.3 and 0.5 milligrams and can get as high as 10 milligrams every night, but the higher doses appear to be associated with more adverse effects such as headache, grogginess, and vivid dreams. Doses over 5 milligrams do not appear to be more effective than the recommended range of 0.3 to 0.5 milligrams 30 minutes before bedtime. So why was it important to go over treating some of the most common side effects of Lexapro? Simply put, since a lot of people are or may suffer from depression, it is very likely that either you or someone you know may be on an antidepressant such as Lexapro. From a pharmacist's perspective, in order to best treat our patients, it's crucial to not only know about the side effects, but it's also very important to have an understanding on how to treat those side effects.